back when I was training, we were in the era of cutbacks, and we had this unfortunate patient, we'll call him Chad, who had got involved in a car accident, leaving him paraplegic, and he was so weak from his breathing muscles, he needed a tracheostomy to help him breathe. And the amazing thing about, we'll call him Chad, is that he was getting better from a breathing perspective, but was heavily reliant on chest physiotherapy and the respiratory therapists doing their thing to help him push out all the gunk in his lungs. All that progress, we're now 3 weeks behind, essentially because of what I viewed as short-sighted ism, where we failed to invest on areas that we know are going to have significant benefits. We know the physios, the discharge planners, the social workers, those are the ones that get patients moving. Those are the ones that impact lives significantly, but unfortunately, often the first to go when it comes to healthcare cuts. Kwadwo Nation, welcome back. We are about to jump on a unique journey, much to the chagrin of my wife. Actually, I don't think I've told her yet, so I hope you're not listening. We are going to be writing a new book. Thank you for all those that have supported unapologetic leadership and prevention over prescription. But there's a book in me, and I think this is the book, in fact. And it's about healthcare reform. What can we do now to help remedy an ailing healthcare system? And what this journey is going to be is you're going to hear me riff on some topics, chapters basically of the book, and you'll witness it coalesce into hopefully a masterpiece. I'm going to predict it's going to be a masterpiece, but I think it's time. It's time to put this together. I'm going to start with a story and tell you why I'm doing this. Okay. So back when I was training, we were in the era of cutbacks, and we had this unfortunate patient, we'll call him Chad, who had got involved in a car accident, leaving him paraplegic, and he was so weak from his breathing muscles, he needed a tracheostomy to help him breathe. And the amazing thing about, we'll call him Chad, is that he was getting better from a breathing perspective, but was heavily reliant on chest physiotherapy and the respiratory therapists doing their thing to help him push out all the gunk in his lungs and to help with his breathing mechanics. But we're in an era of cutbacks. We're in an era of limiting the amount of support we have, especially on weekends or long weekends. And unfortunately, we walk into a long weekend. And Chad doesn't get his chest physio, and he ends up back on a ventilator. After working so hard to be off the ventilator, now he's back on a ventilator. All that progress, we're now 3 weeks behind, essentially because of what I viewed as short-sighted ism, where we failed to invest on areas that we know are going to have significant benefits. We know the physios, the discharge planners, the social workers, those are the ones that get patients moving. Those are the ones that impact lives significantly. But unfortunately, in often the first to go when it comes to healthcare cuts. That short-sightedness, the amount of BS I was seeing, that sparked something inside me. I was like, we're going to be part of the solution. I'm going to go get my Master's of Health Administration. I'm going to start a group called the Resource Optimization Network, looking at ways that we can save healthcare dollars and improve the care that we provide our patients. And ultimately, I would say we were successful at producing papers, close to 100 papers in academic journals, but nothing changed. What this highlighted for me, so afterwards we started our podcast, we started to do more work on social media, produce books, and I realized that often these outside the box approaches can be more impactful in terms of creating change and reaching more people than some of the traditional measures. But looking back at this, the ultimate goal was always impact. How are we going to change people's lives for the better? How are we going to improve this system? And Resource Optimization Network did it through the medical lens, but unfortunately, I felt like we didn't lead to systemic change. We start to focus more on the preventative health side. So we had the prevention over prescription, which is still empowering people and giving people the agency to take care of their own health. But to me, that's only one piece of the puzzle. How do we create change, not only individually, but at a hospital level, at a societal level, to really create impact? And I'll give you some sneak peeks of what we're going to talk about over the course of this series. We know our healthcare system is ailing. I recently walked by a patient in a hallway having to have their patient, their loved one, being treated legit in the hallway, which, as someone that has gone through a loved one during a sick time, like, that's the last place you want to be. You get calls all the time about long wait times for their imaging, to see specialists. My phone, at least once or twice a day, is getting a message about how do we get through this. And right now, with the AI movement that's coming, with the amount of people that really want to take agency and take care of their own health, the time is now for solutions and to act on these solutions. And so, as an example, AI at a high level, improving physician efficiency, can absolutely improve the flow of what's going on within the region. You want to see a specialist, you want to get to the quickest place to get imaging. All that technology is already there to help with decision making. We have the solutions already. Some of them are a big lift, some of them aren't. But the time is now. This book is going to put that pressure on. Let the public know where we can leverage. And those that know me well, it's all about 80-20. What is the small change we can make that's going to move the needle? You know what I'm saying? Similar to prevention over prescription. Push weight. Optimize protein. Do those two things, you're going to be 90% home. Similar to when it comes to healthcare reform, at least at an individual level, a hospital level, at a societal level, we have our solutions. They're not easy necessarily, but the lift might not be that huge before seeing us reaping the benefits. So we'll talk a little bit about AI, the strategies within hospitals that we could use. Another one that I love talking about is how we leverage technology to predict before people even feel sick that they're gonna decline, so that we can intervene earlier. We're already doing this. The tech is already there. So we're going to talk about these things because we need it now. We need the impact, and Canadians and all of us deserve better than what's going on. You come in to hospital with an acute problem, you're going to get the best care, absolutely. But before that, you got some ailment, you need to see a family doctor. 20% of y'all don't have family doctors. We need to solve that problem yesterday. And we got solutions. And so my call to action is reach out. Ideas that you think would be stellar for the book. Share this shit. Like, let's get the word out and start that movement of we're not going to sit on the sidelines, people. We're going to take some agency and really create that future that we need for ourselves and our kids. And let's do this together. This book, I'm hoping to come out by the spring, and I'm going to hustle. And it's going to be part of that moving the needle as far as I'm concerned. Thanks for listening. We're going to connect soon. Stay special.